hi, I'm a 20-year-old guy from Germany. I'm on TRT since 4 weeks, but I still don't feel any benefits. Is that possible? I have lots of symptoms like hair loss, muscle pain, low libido, no energy at all.
4 weeks.
Yeah.
Yeah. Give it 4 months and then give it 4 years. TRT takes time. Like, I mean, and we've spoken about this a lot, and I really understand when guys are starting out and they want to be at end game, like, because you found out what your problem is, and now you kind of got to wait. But I think, I mean, in my experience, I mean, I'm coming up to, when did I start? So I'm coming up to 8 years on TRT. And when I talk to other people who've been on for 6, 7, 8, 9, 10 years, they're like, oh yeah, benefits are still showing up now. Like, it's still compounding in terms of what I'm noticing the effects are. So you got to give it time. And what I explain to my guys when I work with them is like, the starting goal of doing TRT is kind of like throwing a dart at the dartboard. Like, you're most likely not going to hit the bullseye, but the idea is to get close. Because if some guy starts on 120 or 150 or whatever a week, ideally that's going to be his perfect dose in a perfect world. But because everyone's different and responds differently, all we can do is go, okay, well, let's make an educated guess on what's going to be good for you. But then you check in usually in probably another month or two after this gentleman started, depending on his provider, and you go, okay, where are you on the dartboard? And maybe you're way off to the sides, but what they'll generally do is go, okay, we don't know where your bullseye is. We have no idea, but we're going to move it to roughly where we think it is, make a good spot, and then you leave it. And that's what guys really need to do, is they need to get to the point where they can put trust into the process, trust into their provider, which is hard because then they've got to find a competent provider, which, I mean, if you're not able to access a lot of providers in this group, it is very difficult, especially in Europe. This guy's in Germany, right?
Yeah.
Yeah, so tricky as. So that's one of the biggest challenges in Europe that I learned there. When people go change provider to a better one, it's like there aren't any. Like, there's no one to choose from. But yeah, basically what you want to do is the main benefits from TRT. I think people, when they're starting out, and I understand why, because they're new to it, is they're looking for the acute effects, and the acute effects are nice. But what we're really looking for in resolution of low T symptoms is chronic exposure to androgens, and how that will undo and reprogram through DNA signaling the maladaptive coping mechanisms and basically faulty pathways that are formed from a prolonged experience of low testosterone. And this can be mental thought processes to do with learned fear and low self-esteem and the identity, physiological processes to do with inflammation and all kinds of issues resulting from low testosterone. But then you've also got the biggest part of the equation, which is the impact that the low testosterone has had on the discourse of your life. So if you've had low testosterone during your formative years or for decades, you're going to be in a situation that you now need to come back from. So you may have a lot of work to do in terms of working on your body, your mind, your career, your relationships, all these different things that you may have a bunch of work to do until you can get to the point where you have the benefits of being a high testosterone man. Because when you look at all these guys out in the world who are like, what people would perceive or identify as like an alpha high testosterone man, it's not just because he has testosterone that he's like that. It's all the habits and everything around him that makes him that way. And generally guys have got to go from being at nothing or being in a state of dysfunction to building all those things and then doing them consistently. And that's where I think people would rather, and I understand why people feel this way, because they get sold that this is the solution, is that the difference between here and here, it's this injectable version of this peptide, or it's this supplement from this person, but fuck off. Like, it's work. And there are supplements that can help that pathway, and dialing in the testosterone to getting it perfect will definitely expedite that process. But the foundation of where this gentleman is at is get it roughly right, within roughly around that bullseye, leave it, and go and show up every way that you go to bed every night proud of yourself, that you're 1% better than you were yesterday. Do that for weeks and weeks and weeks and weeks at a time. And that positive momentum forward is the healing response that you're looking for from TRT.